as of today, we have plenty of hospital capacity to respond to the needs of our communities for COVID-19 today. But here's the deal. Two things about it. One is those numbers are the average numbers for the state of Texas, and availability in one community may be greater than it could be in another community. And that brings me to one of my key points today. And that is, our job is not to simply make assessments of where we are today and be satisfied with that. Instead, our job is to make sure that we're looking 1, 2, 3, and 4 weeks ahead and make sure that Texas is going to be prepared to meet the needs of your communities if COVID-19 continues to increase across the state of Texas. As a result, for weeks now, we've been engaged in strategies to figure out ways that we can begin the expansion of healthcare facilities to make sure we will be capable of accommodating the needs of all Texans who may contract COVID-19. Very importantly, along those lines, existing hospitals will continue to be the primary location to treat and care for those in need. But we must prepare for the worst case challenges as they arise. To begin that process, I deployed the National Guard Task Force brigades to assist with healthcare infrastructure in Texas. That includes General Tracy Norris, the general in charge of the National Guard here in the state of Texas, and myself. We have both been working with Brigadier General Paul Owen of the U.S. Army Corps of Engineers. Their teams have been working to identify locations that could be used if current hospital capacity is exhausted. They looked at various different things, including recently closed hospitals or other pre-existing healthcare facilities. They looked at things like convention centers and arenas. And they have looked at hotels that are vacant now because people are not staying in hotels right now. The type of facility that will be needed will largely depend upon a certain region's unique needs, as well as what facilities are available in that particular region. So for us to stay ahead in this process to make sure that your needs are going to be met, today we are announcing the first of these new facilities, and based upon the consultation and advice of the assessment of facilities that are available, but also consultation and advice with the U.S. Army Corps of Engineers about which location and which it is most needed. So given what we have seen about the current spread and escalation of the spread of COVID-19 in the Dallas-Fort Worth area, the location that we are announcing today is the K. Bailey Hutchison Convention Center in Dallas, which will be set up to expand healthcare facilities. There are pictures of this over here, which probably are kind of hard for you all to see. But what it shows you is that as we gather today in the K. Bailey Hutchison Convention Center in Dallas, Texas, there are already very large-scale medical kits and equipment that exist in that convention center, that all that is needed to be done to be able to make sure bed space is available there is for those kits to be set up. So right now there's the capacity in K. Bailey Hutchison Convention Center for 250 beds with plenty of room to massively expand that number if that is needed. But understand this also, that if we do have a massive increase in the number of people who are contracting positive with COVID-19 who need hospitalization, we have the ability to go to other locations in the Dallas region. But understand this also, as we gather today and speak to you today, the state is working with the Army Corps of Engineers to locate additional potential facilities both in the Dallas-Fort Worth area as well as other regions where COVID-19 is spread the highest here in the state of Texas. So yes, we will be looking at locations in places like Houston and San Antonio and Austin and the Rio Grande Valley, El Paso, in every part of the state of Texas where this need may need to be called upon sometime in the near future. But I want to reiterate a couple of things. We urge local leaders and owners of facilities to contact us if you are aware of structures or facilities that could serve as temporary healthcare facilities. If you have such information, if you would share it at that same website, which is www.texas.gov. That's www.texas.gov. And I want to reiterate that hospitals will continue to remain the primary location for care. Patients with acute needs will be prioritized and cared for at hospitals. Now, I'm going to provide the opportunity for the generals to speak more upon that here shortly. But before we get to that, I will be issuing some additional executive orders today. The first executive order concerns travel. Understand that executive orders that I issue about travel is keenly focused on one main goal, and that is to reduce importing COVID-19 into the state of Texas. The best way to do that is to do all that we can to restrict travel into Texas from areas that have a high rate of COVID-19. One of those areas is our neighbor in Louisiana. It's well known, well documented about the massive amount of COVID-19, not just now in New Orleans, but spreading out across the state of Louisiana. Well, my prior executive order about travel from New Orleans covered air travel from New Orleans into the state of Texas. Now I am updating that executive order to also include travel by road. And it's travel by road from any location in the state of Louisiana. Importantly, this executive order does not apply to travel related to commercial activity, military service, emergency response, health response, or critical infrastructure functions. This order will be enforced like the order that I issued previously about travel from New Orleans. It will be enforced by the Texas Department of Public Safety at and near entry points from Louisiana. Everyone stopped by the Texas Department of Public Safety will follow the very same self-quarantine procedures in the pre-existing order. So that's it for travel from Louisiana. Now, as we all know, since my last executive order that put self-quarantine centers into place for those traveling by air from New Orleans to Texas, since that time there has been an increase in the number of hotspots identified across the country. Hotspots where it would be equally dangerous for people to be traveling into Texas from those hotspots. So, in part in consultation with Dr. Hellerstedt, who is the chief medical doctor in charge of this particular operation and in charge of the State Department of State Health Services, but also in part based upon the doctor in charge of the White House Task Force in response to the coronavirus, Dr. Deborah Birx. We are expanding the executive order requiring quarantine of passengers flying into Texas to include more departure locations. They include Miami, that would be Miami, Florida, Atlanta, Georgia, Detroit, Michigan, Chicago, Illinois, as well as any air travel from the states of California and Washington State. In addition to the executive order or orders concerning enhanced restrictions on travel to Texas from other states, there's another executive order that I'm announcing today. It's an executive order to make sure that I, as governor, and that we as a state of Texas are doing all we can during this time of disaster to keep the state as safe as possible. So I am issuing an executive order to stop the release of dangerous felons from prisons and jails in Texas. I've heard from law enforcement officials as well as citizens alike who have raised concerns about releases that have already taken place or anticipated releases that could take place of dangerous criminals in jail because of COVID-19. The governor is charged under Chapter 418 of the Government Code to maintain the safety of our state during a time of a declaration of disaster. Releasing dangerous criminals makes the state even less safe. That also complicates and slows our ability to respond to the disaster caused by COVID-19. We want to reduce and contain COVID-19 in jails and in prisons for the benefit of both the inmates as well as the law enforcement officers, the employees, and the staff of those facilities. We've already worked with the Texas Department of Criminal Justice on solutions, and we will work with all local authorities on solutions. But releasing dangerous criminals from jails into the streets is not the right solution. And doing so is now prohibited by law by this declaration. But let me say this. What Texans have done over the past 10 days is a demonstration of the way Texans always respond to challenges. We know that economically and personally, it is an enormous challenge for you to abide by these standards, to stay at home, to slow the spread, to make sure that you are doing your part, to make sure we have a limited expansion and we have maximum containment of the spread of COVID-19 in the state of Texas. You know, we are engaged in a war that threatens your public health and the lives of some of you. The interesting fact about this war, unlike so many other wars, is you have all the tools that you personally need in order for you to personally win this war. You can protect yourself from being a victim of this war by you making sure that you reduce your interaction with others for a period of time to make sure that we will be able to slow the spread of the coronavirus in the state of Texas. You have in your hands that capability to stay home, to stay off the streets, to reduce your communication with others so that you will not be contracted COVID-19. And what we know also is this. This is not the first time that Texas has ever been tested by a challenge. We're tested by challenges almost every year. We're tested by hurricanes, by fires, by storms. And yes, we've been tested by infectious diseases like this in the past, whether it be H1N1 or Ebola or SARS, etc. Regardless of the challenge, Texans have always been up to that challenge. I know that here again, we will be up to that challenge. And I know here again, Texas will lead the way as we work our way out of this challenge and put Texas back onto the pathway of once again becoming the number one state in the United States for doing business and for economic vitality. But the sooner we're able to get there is going to be dependent upon everything that you continue to do to make sure that you reduce the spread of the coronavirus in Texas.